Teal Journey. So for those of you that are following this journey, I last posted after I had the port put in and was about to get ready for the first chemo treatment. Well, chemo treatment came. Actually, the whole process of chemo itself is not terrible. You just kind of sit and wait while everything gets run through in the system. Get up, walk around, take your pole with you, and everything like that, so that's not very stressful. I did decide next time I'm going to take my computer because I don't sleep. Tried to, didn't work. So I need something to keep myself occupied for the 6-ish hours of that. So the bad part about chemo is not the beginning, the actual doing the chemo. That's the easy part. The bad part is what happens afterward. And with ovarian cancer, the treatment is paclitaxel and carboplatin. I think that's how you say it. Anyways, I've tried practicing, I can't get it right. But whenever you have these two medications, they start out by giving you Pepsid, steroids, and Benadryl. The interesting thing with paclitaxel is a natural thing. Like it comes from a yew tree of some sort, which I can't remember exactly what kind it was, but they told me. And it has to have a preservative because it's a natural thing. And that preservative is castor oil. And the reason they have to give you Benadryl is because so many people are allergic to the actual castor oil, not the medicine. So I thought that was interesting. Carboplatin is just a platinum-based drug that is also pretty effective at dealing with ovarian cancer. However, my type of ovarian cancer, the clear cell carcinoma, is platinum resistant, so it is a good thing that it was caught early because caught later tends to be a less positive outlook. The kind of side effects don't really sit in at first. At first, you feel great. You feel great because of the steroids. Giving you energy, you feel great. Thursday, I went to work, got up, put on my makeup. I was like, oh, great, I feel good. You know, this was not as bad as I thought. Then I got home, and about 7 o'clock, I just crashed completely. And I could not get out of bed. It was the worst sleepiness I've ever encountered. I did go to work the next day on Friday. Didn't do a whole day because I had to leave to take my FMLA to the cancer clinic and to go to the dentist because I'm waiting for a plate to be coming in. So I came home that day, fell asleep again, pretty much stayed asleep all night. This morning I slept until about noon, then I got up. I get about an hour or two, then I need to lay down and rest for a little while, but the tiredness just doesn't go away. All the sleep in the world doesn't make it go away. And that's difficult because I've struggled with exhaustion and stuff for a long time, and it's hard to make it through the day when you feel like you could just fall asleep at any moment. And it just makes the whole thing tougher. Now, the nausea hasn't started yet. Usually that takes a little while to set in because they use the anti-nausea meds during chemo treatment. So they said it could be 3 to 5 days before that starts hitting me. So when they do that, then we'll have to take the nausea meds, which I have 2 prescriptions, 2 different ones. One is Zofran, which I think everybody pretty much knows about Zofran, and another one that starts with a P. I can't remember the name of it, but it's a long name. She said it was an older medicine, but it still works really well. So those I have already. The process with the port, though, was really easy. They give you lidocaine cream to put on your chest where the port is so they can kind of numb the area. And you put that on about 30-45 minutes before the appointment, and then you cover it with a piece of cling wrap, and that keeps it from rubbing off onto your shirt. Then they just wipe it off, clean up the area, put a mask on you so you don't breathe on the area of the port, and then they take a special needle and put it in through the port. Only specialized nurses can do this. So most of my blood work will be done at the oncology center from now on, at least while I have a port, which honestly I'm not keen on having it pulled out right now. It was hard enough getting it put in, so I keep it for a while. We'll see. At least a year, he said, would be a good idea, so just in case of recurrence. But the important part is that I made it through the first one. I just got to power through a lot of these symptoms and side effects and everything to get through the next 5. And it seems like a lot right now, especially looking at it, but this is what I've got to do. And no matter how tired I get or how exhausted I become, this is going to be my life for the next couple of months. And it's just the way it is. I can't change it. I can't make it go away. This is just what I'm going to have to do. I think another thing that has really kind of opened my eyes to a lot of stuff lately has been how few women and people of other genders that have female reproductive organs have not had any education in what their reproductive organs are. And not only that, but when they've already had surgery, don't know what kind of surgery they had. It was interesting, a doctor was on a reel talking about, that you need to still go to your gynecologist even if you've had a hysterectomy. And of course everybody was like, I had a hysterectomy, I don't have anything in there. And it's like, if you had a hysterectomy is simply the uterus, and a total hysterectomy is the uterus plus the cervix. Unless you have actually had a salpingectomy, which is the fallopian tubes, and an oophorectomy, which is the ovaries, you still have ovaries. And that's an important distinction. If you have only had a hysterectomy or a total hysterectomy, you still need to go, because what if there's a cancer on your ovary? And this is where I am very pedantic when it comes to accuracy, because doctors need to accurately describe what is happening to their patients so they know what their situation is. It is not safe to assume they took out your ovaries for a total hysterectomy. You need to know that. You need to be sure that this is what happened. And if they only say on your paperwork they did a total hysterectomy, that's all they did. Unless they indicate they have done the other procedures, then they may not have, and you may still have ovaries. And that can be a dangerous situation to be in, because you may develop ovarian cancer and not know it. Because, as I've mentioned before, sometimes there are no symptoms, and other times the symptoms that there are dismissed by a lot of doctors or even the people that have them, because they're just not serious enough. And that's a big problem. And this all comes back to doctors not taking women's health seriously. And when I say women's, I include other genders who have female reproductive bits. I just use it for shortness. But there is a lot of different people that do have the quote-unquote female reproductive system. Anyone that does needs to be aware of what they have and what they need to do. Old school doctors will tell you once you have a hysterectomy, you don't need to go back. That is totally wrong. Even if you have had everything out, like I have, no uterus, no cervix, no ovaries, no fallopian tubes, no nothing, right? You still need to go, because cancer can still develop on the cervical cuff, and that can be serious as well. So you need to make sure that those things don't happen. Just because you've had everything out doesn't mean you're in the clear forever, especially if you had everything out for cancer. And that's just, it sucks, yes, because nobody likes to go to the gynecologist. But if you want to stay healthy and you want to live a long life, it's the only way to do it. And I have heard some horror stories of gynecologists missing ovarian cancer, like very obvious ovarian cancer, and ignoring their patients and not listening when they tell them they've got these consistent symptoms. And yeah, there's those doctors out there, but that's the time that you need to look for another doctor for a second opinion, and one that will listen to you. And I'm not saying all older doctors are like this. It just seems that the more old school techniques, which involve ignoring some of this stuff, are with those older doctors. So you want a doctor that's progressive no matter how old he is. You may be young, you may be old. You gotta trust your care team. You've gotta have a care team that listens to you. And I mean, I spent the entire year of 2025 trying to figure out what was wrong with me. I felt terrible, I was tired, I just couldn't get it together. I thought it was diabetes at first, so I ended up getting on the Zepbound shot so that I could control my diabetes and lower my weight, so that would help with my diabetes, because I was almost 300 pounds. And that's a lot of weight on your frame. So I started the Zepbound. And then I put everything on to, well, my stomach feels weird, it must be the Zepbound. That's just my GERD symptoms, and things like that. And I wonder now, looking back, how much of that was actually symptoms of the ovarian cancer. Because it would have been developing during this year. Because my gynecologic exam was done on February 28th of 2025, and she didn't find anything at that point. So that means that this cancer grew within 10 months to 5 centimeters almost. I think the cancer itself was 4, and then, but on the CT it looked like 5. So, but just think about how this can happen so rapidly. It can be something that completely destroys your life in less than a year. And, for my case, I've had everything turned around in my life in 3 months. We're coming up on the 4th month, and it's going to take a couple of more months after that. And I've got to deal with that the best way I can. And the different things I did over the course of 2025 wasn't the fault of my doctors. Everybody did what they could. My main doctor, my PCP, is a nurse practitioner. She's a fantastic nurse practitioner. I love to go to her. My son goes to her. Ex-husband sees her too. She's just very good. And she listens. And never once while I went to her did she blame everything on my weight. Whenever I did broach the subject of my weight, she was supportive of me taking steps to lose weight, and she was supportive of trying to help me control my diabetes. Every time I've asked for a certain test, she's done it. To eliminate thyroid issues, I had the full thyroid panel. Everything comes back normal. T3, T4, TSH, all of it's normal. I do take thyroid medicine, but this was just to check and make sure it was working. I was like, okay, well, what about autoimmune? Maybe this is an autoimmune disorder that's causing all this, because, the inflammation and everything that I was experiencing something was causing it. And so she ran every panel in the book, all the hepatitis screenings, the rheumatoid factor, all of those. She ran all of those, and of course everything came back negative because it wasn't autoimmune, it was cancer the entire time. And since I had just had an exam, there was no reason for anybody, my doctors or myself, to think that it could be something like ovarian cancer. I mean, that's a very short time for something to develop, but it did. And I was lucky in that I had people that took me seriously. And when I went to the ER, the doctor there, fantastic doctor. I couldn't have asked for a better ER doc. He was on the ball, got my blood work back, found my white count was sky high, and that things were not adding up on the blood work, and he immediately sent me for a CT. When the CT found the mass, he sent me back for sonograms. All of those confirmed that there was a mass there. And then the next day, my gynecologist had already started the process of sending my information to the big oncology center in Kansas City. So she also did the CA-125, which is the cancer antigen, which came back at almost 3,000. So when I did go to the doctor in Kansas City, she said, well, you don't have any other signs of cancer. You've got some inflammation, but that's not usually something that we see. And she's like, the lymph nodes look fine. There's no obvious lymph node involvement, and we don't see anything else. So this might not be cancer. It might be an infected ovary. And of course, it had to come out no matter what it was. So, but she scheduled the surgery for just 2 weeks later for the 31st of the month. And of course, that's when they did the pathology and found out it was cancer, and a couple weeks later it came back as clear cell carcinoma. So I guess all this comes back to, you need a care team that you can trust. Whether you have cancer, whether you have diabetes, whether you have whatever you have. Even if you're perfectly healthy, you need a trustworthy care team. You need somebody that you can go to and talk to about all kinds of things that are happening in your life and symptoms you might be having. Being exhausted all the time isn't normal. And a lot of people just ignore it because they think that's the price of being in the society we live in, right? But it's not. It's not normal. And not everything can be written off to anxiety. Anxiety can cause a lot, and it can mimic other symptoms. But those symptoms need to be checked out, even if they think it's anxiety. I have one tip before I go. If you ever have a doctor who doesn't want to do a test or look into something further that you believe needs to be looked into, always say, hey, put it in my chart that you are declining to do the test I want. 9 times out of 10, they're going to do the test, because if something does come back later that they should have done the test, they can be liable for it. Sometimes we got to push things, and sometimes we got to advocate for ourselves in a strong way. That's just the world we live in, especially if you're a woman or identify as a woman or are assigned female at birth, because a lot of times our pain is not taken seriously, and we need to advocate for all of us, and I think that's a big deal. Alright, so it was great talking again. I hope to see you soon. Give an update on how things go. Hopefully soon this starts to fade away. Looks awful. But I will talk to you all at the next episode.